Hi, my name is Dr. Ross Hauser. Welcome to Caring Medical Florida in beautiful Southwest Florida. In 2009, I had an article published in Practical Pain Management, which is a journal for medical doctors that are interested in pain. And it was on wrist instability. And it was data from a charity clinic that I ran from 1994 to 2005. Now the wrist is basically 8 bones that are in a sea of ligaments. So it's those ligaments that are treated with prolotherapy. Wrist instability is notorious for causing triangular fibrocartilage complex tears. So that would be pain on the side here. So prolotherapy works very great for that condition. And then if you don't resolve wrist instability, it can lead to wrist osteoarthritis and you start losing range of motion of the wrist. In this study, 2/3 of the patients were females. There was 31 wrists. The average years of pain prior to coming to the charity clinic was over 4. The average person had seen 3 doctors prior to seeing us. Most patients were on an anti-inflammatory, some kind of pain medication. About half of the patients were told that there was nothing that anybody could do for their wrist pain. That was told by physicians prior to them coming to the charity clinic, and 16% were told that surgery was the only option. It's very advanced, painful conditions. The interesting thing about this data was we talked to the patients 22 months after their last prolotherapy visit. So you'll see from the data, it's clear that the effect of prolotherapy lasted. The average pain was 5.5 starting, it went down to 1.4. And you could see that even in the patients where the doctor said you have to get like a wrist fusion or some kind of wrist surgery, they had about the same amount of pain relief. And the p-value was very, very significant, meaning the results were unbelievably significant that prolotherapy works. Stiffness went down, exercise ability improved. 36% prior to prolotherapy could exercise greater than 30 minutes, but after prolotherapy, 87%. And then the 5 patients where the doctor said surgery was the only option, 100% of them received greater than 50% pain relief with prolotherapy. And this is what it looks like. This is what comprehensive prolotherapy of the wrist looks like that we did at the charity clinic. The solution that we used was the dextrose solution. In private practice, there are other proliferants that we use, including platelet-rich plasma. So you'll see that all the shots go down to the bone. So there's something like 27 different ligaments in the wrist. So pretty much we're gonna do almost all of them. And you'll see the treatment goes very quickly, but it's very, very effective. Now, the reason why there's so many shots is by the time a person has had pain for 4 years, that it might have started out as one ligament injury, but by the time we see them, because ligamentous joint instability is a progressive disorder, by the time I see them, there's just all kinds of crunching, grinding, clicking, and that's a sign that there's instability. Now, common instabilities in the wrist are scaphoid lunate, instability of the capitate and lunate, that joint that is commonly involved with wrist instability. You see me here doing the base of the thumb too, because the base of the thumb is right by the wrist, and a lot of times that's a co-structural morbidity with wrist instability. So prolotherapy works great for wrist instability. It's best to get treated early before the degenerative process occurs, because in the wrist, when you start getting arthritis in the wrist, you lose a lot of range of motion. And of course, you don't realize to do all the things that we want to do, you need to maintain wrist motion and wrist stability.